Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very interesting topic related to medical coding anatomy, where we will be discussing about some of the pathological conditions related to eye. Okay. Prior to that, we have already covered the anatomy of eye in detail. We also talked about anatomy of ear in detail, right? Now, one by one, we will talk about their pathological condition, like what are the pathological conditions are there for the eye, right? Because these terminologies, these abbreviation will help you to understand the things properly at the time when you are going to examine the documentation for coding purposes. Okay, that's why it is very important to understand it. Now, before we start with this thing, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for timing we are just mainly focusing on all the pathological condition that is related to eye. And for that you can also, as I mentioned, like you can refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you have any queries, questions related to that, then feel free to reach out to me through comment section. I would be more than happy to answer all your questions. Okay. Alright, so let's get started and see the first category for the pathological condition related to refractive errors of eye. Okay, so we will go one by one. Okay, firstly we'll talk about refractive errors, then we will talk about the structural disease. Okay, so the first thing is astigmatism, which happens when the cornea or lens has a irregular curvature. Okay, because of any injury or something, if irregular curvature is diagnosed on the cornea or lens, then it causes a light light to focus unevenly. Okay, and we all know that if light is focusing unevenly, then it will result in the blurred vision for all distances. Okay, so this condition is known as astigmatism. Okay, next is hyperopia. Hyperopia means also called as hypermetropia, which is commonly known for farsightedness. Farsightedness, it occurs when the image focus behind the retina. So just remember this thing: if the image is processing or focusing behind the retina instead of directly on it, then making it close-up object appear blurry. So in this situation, the things which is closer is appear blurry. Similarly, we have myopia, which is a commonly known as nearsightedness. Nearsightedness. And it basically occurs when the image focuses in front of retina instead of directly on it, making them distant object appear blurry. So in this case, distant object is seen as blurry. Then we have presbyopia, which is a normal natural thing, age-related decline in the eye's ability to focus on nearby object, typically becoming noticeable in the middle age. Okay, so at the time of middle age, I lose the ability to focus on the nearby objects, and which leads to the some blurriness or blurriness that leads to that is mainly noticeable at the middle age. Clear? So these are the all pathological condition for eye refractive errors. Now we will talk about pathological condition for structural diseases. And I think this term is, I'm sure you all know about this term, that is cataract, right? Now what is cataract? It is the clouding of the normally clear lens of the eye. Clouding, okay? Clouding of normally clear lens of the eye, which leads to the blurry or decreased vision over the time. Clear? After that we have callation, which is a small hard cyst-like lump, which is also known as granuloma, that forms on the eyelid, usually due to the blocked gland. Clear? After that we have diabetic retinopathy. Diabetic retinopathy is refers to the damage of retina caused by the diabetes. Okay, is if any due to any reason or diabetes, due to any reason of diabetic, if the retina got damaged, then it cause diabetic retinopathy. because it can also include tiny bulging blood vessels, bleeding, swollen retinal veins, and growth of new fragile blood vessels. Okay, so this thing comes under a diabetic retinopathy. Next we have is glaucoma, which is a condition in which increased pressure inside the eye, intraocular pressure, gradually damage the retina and optic nerve, which can lead to permanent vision loss if untreated. Okay, this is called as glaucoma. Then we have blepharitis. Blepharitis is an inflammation of eyelid which cause redness, crusting, and swallowing along the edges of the eyelid. Clear? After that we have dacryocystitis, which is a blockage, inflammation, and the infection of nasolacrimal duct and lacrimal sac, leading to redness and swelling in the area between nose and the lower eyelid. Clear? Then we have ectropion, which is nothing but a outward sagging or turning out of the eyelid. In this situation, eyelid turned outward, which can prevent tears from draining properly and lead to the corneal drying ulceration. Okay, because tears are not draining properly. Opposite of it we have entropion, which is inward turning of the eyelid, which cause the eyelashes to rub against the surface of the eye and can cause corneal abrasion. Clear? So just remember these important terms. Okay, and don't worry if you are not able to learn it immediately, it's fine, by the time you will remember it. Next we have hardulium, which is also called as sty. It is nothing but an infection of a small oil producing sebaceous gland in gland in the eyelid, producing a small superficial white nodule along the lid margin. Okay, then we have ostis, which is dropping of the upper lid, usually caused by neuromuscular problem or an injury affecting the muscle that lift the eyelid. Clear? So these are the all condition, pathological condition. Likewise we have xanthelasma, which is raised yellowish plaque that forms on eyelid caused by the underlying disorder of lipid fat metabolism. And macular degeneration is the progressive breakdown of macula, the central part of the retina responsible for sharp, detailed vision and leading cause of the vision loss in older adults. Clear? After that we have nystagmus, refers to a repetitive rhythmic involuntary movement of the one or both eyes, which can be horizontal, vertical, or rotatory in direction. Then we have retinal detachment, which occurs when the layer of retina separate from each other, which is serious condition that can lead to a loss if not treated immediately. Clear? So these are the all pathological conditions related to eye on the basis of structure and disease. Now we will just conclude the session, but before that let's talk about some of the common abbreviation related to eye that will help us to understand the things properly at the time when we are going to document it. Okay, so you can see here AMD, which stands for age related macular degeneration, a progressive eye disease affecting central vision in older adults. Clear? Then we have HWENT, which is mainly stands for head, eyes, ears, nose and throat, a general term used to describe this group of body regions together. Next we have is IOL, which stands for intraocular lens, an artificial lens implanted in the eye, often during the cataract surgery. Next we have is IOP, which stands for intraocular pressure, the fluid pressure inside the eye, which is important in diagnosing and monitoring glaucoma. Then we have LASIK or LAISK, which stands for LASIK, stands for laser in situ keratomyelitis, a common laser surgery used to correct vision by reshaping the cornea. Then we have PERLA, PERRLA, which stands for pupils equal round reactive to light and accommodation, a standard phrase used to document a normal pupil examination. Then we have POAG, stands for primary open angle glaucoma, the most common type of glaucoma. Then we have PRK, stands for photorefractive keratectomy, a laser procedure that flattens the cornea to correct myopia, which is nearsightedness. Then we have VA, stands for visual acuity, a measurement of how clearly a person can see. Next we have is BF, stands for visual field, the entire area that can seen without moving the eyes, often tested to detect the loss. So yeah, these are the all abbreviation that we should know, and don't worry if you are not able to learn these things immediately. By the time you will recall these things, okay, when we will be discussing the practical part. And now there is one question for all of you, and remember, those who are answering these questions frequently, I'm sure like I'm going to create one special shout out videos for all those candidates who are actually sharing their expertise with everyone. And today's question is, what is the true organ of the hearing? So just share your answer in the comment section. In case if you don't know, it's quite easy. You can refer the previous session. There you will find the information, and from there you can learn, and then you can share your information within the comment section box. Remember, when you are sharing these comments frequently, I am getting the notification of each comment, and then on the basis of that only I am releasing more sessions. So more the number of comments, more the session will be published. Okay, so please do share your knowledge in the comment section. That's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.